Hey, guys, welcome back to our channel. Today we're going to talk about a topic that many of you have been asking us about, hair transplant on the crown area. Losing hair on the top of your head can be a frustrating and embarrassing experience, but luckily, there are effective treatments available. In this video, we're going to walk you through the process of a hair transplant on the crown area, including what to expect before, during, and after the procedure. Hair loss in the crown area is a common problem that affects a large number of men worldwide. This type of hair loss can be caused by a variety of factors, such as genetics, hormonal changes, stress, or certain medical conditions. Regardless of the cause, hair loss in this area can be distressing and can have a negative impact on a person's self-esteem and confidence. Fortunately, hair transplant surgery is a safe and effective solution for those who want to restore their hairline and achieve a fuller head of hair. The procedure involves taking healthy hair follicles from the back or sides of the head, where hair is typically thicker and more resistant to hair loss, and transplanting them onto the balding areas of the crown. The surgery is typically performed under local anesthesia, which means that the patient remains awake and alert throughout the procedure. The surgeon will carefully make small incisions in the balding area and implant the hair follicles, one by one, to achieve a natural-looking result. The length of the procedure can vary depending on the size of the area being treated, but it typically takes several hours to complete. After the surgery, patients will need to follow a strict postoperative care routine to ensure proper healing and the best possible results. This may include avoiding strenuous physical activity, avoiding exposure to sunlight, and following a prescribed medication routine. The surgeon will provide detailed instructions on how to care for the scalp and ensure the success of the transplant. The results of a hair transplant on the crown area can be dramatic, with patients typically seeing new hair growth within a few months. The hair will continue to thicken and grow over time, resulting in a full head of hair that looks and feels natural. After a hair transplant, it's important to follow some postoperative instructions to ensure proper healing and the best possible results. Here are some things you should do after a hair transplant. Keep your scalp clean. It's important to keep your scalp clean and free of bacteria and dirt after a hair transplant. Your surgeon will likely provide you with instructions on how to clean your scalp and when to start doing so. Use a mild shampoo and avoid rubbing or scratching the scalp. Avoid physical activity. For the first few days after your hair transplant, it's important to avoid physical activity that could increase blood flow to your scalp. This includes strenuous exercise, bending, lifting heavy objects, and any activities that could cause sweating. Avoid direct sunlight. Direct sunlight can damage your scalp and hair follicles after a transplant. Wear a hat or use an umbrella to protect your scalp from the sun, especially during the first few weeks after the procedure. Follow medication instructions. Your surgeon may prescribe medication to help prevent infection and promote healing after your hair transplant. It's important to follow the instructions for these medications carefully and to complete the full course of treatment. Sleep in an upright position. For the first few nights after your hair transplant, it's recommended that you sleep in an upright position to reduce swelling and promote healing. Be patient. Hair growth after a transplant is a gradual process, and it may take several months before you start to see significant results. Be patient and follow up with your surgeon regularly to monitor your progress and address any concerns. By following these postoperative instructions, you can help ensure that your hair transplant is a success and that you achieve the results you're looking for. In conclusion, hair transplant surgery is a safe and effective solution for restoring hair to the crown area. If you are experiencing hair loss in this area, it is recommended to consult a hair transplant surgeon to discuss your options and determine if the procedure is right for you. With proper care and follow-up, a hair transplant can provide long-lasting results and improve your confidence and self-esteem. Thanks for watching, and we'll see you in the next video.